Okay, when you do counseling, one of the things that therapists are required to do is a thing called informed consent. With the informed consent, what you do is you explain to the client what the options are. And among the recovery options would be the traditional 12-step programs. We would talk about those. And then we would talk about the alternatives to the 12-step approaches. Which recovery group to use is related to what works best for the client. It's something that the therapist doesn't impose upon a client.
There are principles of effective treatment of addiction that was written up by NIDA, the National Institute of Drug Abuse, some years ago. And the very first one was no single treatment is appropriate for all individuals. Number one.
You know, AA is not for everyone, and I mean the realization that of this AA is not for everyone. This is part of the maturity of the fellowship.
Dr. Valent was quoted in Grapevine, AA's Grapevine, is saying that 40% of people who came to AA got their recovery there, and that 60% got it somewhere else.
The AA alternatives tend to have a thing in common to where they actually focus a lot on being self-reliant and depending upon yourself to do something about the drinking. There is a range of programs that present other alternatives to 12-step programs. For example, there is a program that was developed by Jean Kirkpatrick in the 1970s called Women for Sobriety. Jean Kirkpatrick was recovering herself from an alcohol problem, and she felt that AA emphasized reducing humility and self-centeredness too much. In other words, she was saying that this is not exactly what women needed. She felt that women needed a program that sort of increased their self-value, that made them feel positive about themselves and about life. And so her program focused on positive self-affirming statements and reducing negative destructive statements. SMART is one of the alternatives. Through SMART recovery and the approach of cognitive behavior therapy, a member would learn to recognize some of those thoughts that lead to drinking and to challenge those thoughts and replace them with thoughts that are more rational and thoughts that enhance sobriety. It actually has a 4-point program for success. The major points in SMART have to do with motivation, how to enhance your motivation so that you are motivated in a positive way to actually want to quit drinking, to where you see it as something not as a have to or something horrible that you have to go through in giving up drinking, but rather as something that is life enhancing, that will make your life a lot better. So one point is to help members change the thinking to where they feel good about what they're doing. A second point has to do with coping with urges to use. Because if a person is not successful during that moment when they're actually thinking about using, they're not going to be successful in achieving sobriety. A third point in SMART recovery has to do about changing your life, learning to deal with life and cope with life in a rational way, in a positive problem-solving way, looking for solutions rather than using. And then the fourth point, which may come closest to the aspect of spirituality, is having a reason and a purpose in your life to where you're focused on long-term goals rather than short-term goals. You learn to achieve a healthy balance in life and have your life to mean something. Another program was developed by James Christopher in the 1980s. It's called Secular Organizations for Sobriety, sometimes referred to as Saving Ourselves. It's a program of recovery that has very little structure except for some suggested guidelines for sobriety. And they're strong believers in separating sobriety and religion, but they're yet another option.
One of the things I learned, I used to chair AA meetings and went to a lot of meetings, hundreds, was that frequently I heard of the insanity of alcoholism, or the insanity of the disease, was doing the same thing again and again and expecting different results. And I became, through my own experience, to view that there was also an insanity of recovery, and that was trying something that didn't work, coming back in, and then being told to do it again and do it again. And how many times did I have to go back to that same program? From a treatment perspective, it's unethical. There are a variety of treatment approaches which have been shown to be effective for different individuals. We just have to keep trying new things, new ways. There's always if something doesn't work, we learn by error. So in that sense, SOS has been likened to a scientific approach to recovery. And in its most simple, most basic sense, that's the scientific process, is trying something new when it doesn't work, or trying something to make it work better. There's just so much energy is wasted in NA being better than AA, or vice versa, or AA being better than SOS. And it's just, there's divisiveness, and there's competition, and it's wasted energy. Is that we should be celebrating that there are multiple paths. We should be building bridges. One size shoe does not fit all. And if the ultimate goal, I see there are more similarities than differences between SOS and AA and NA, is that they all have the same goal, is recovery. And once again, if those bridges could be built, if the respect for the individual can be held onto, that live and let live, then we could be assisting people and helping them to find their path.